Now we'll see Dad's elbow being dressed.
This one is slightly different. I'm going to peel back the old dressing.
Does that hurt, Dad?
Well,
I don't think you'd tell me if it did.
that would have been really hurt.
Busted. What am I gonna do without you, mister? I can also put in some alcohol wipes if you need to try and use it to brush off the adhesive.
Oh, okay, thank you.
If it's too stuck, you do something kind of like this. As you peel, brush away.
Good to know.
But these ones are usually quite gentle. This one, whoever applied it, just did a good job of making sure it adhered correctly. You'll also notice I'm kind of holding the skin down.
Yeah, that makes sense.
As I pull away. Little tender on the underarm, isn't it?
Oh, it's a freezer. Oh, yeah.
Pops, that looks really clean though. That looks good.
Is it open still quite a bit?
It is still
is.
open, but
But it's
maybe
really,
a third of how open it was last week.
Yeah, it's really starting to fill in.
Similar idea. We're gonna take our gauze and our wash, separate the two sheets, take one, saturate with wash, and pat. You don't need to go inside the wound bed itself.
I'm really impressed with your body's healing capabilities, Pops. It's working hard and doing a good job.
Oh, it's good to hear.
And because this one's been a little more moist, instead of transfer, we're gonna use this blue guy. And that's just what we'll call it, 'cause it's got a weird brand name. And it's pretty firm when you get it.
Okay, so that's something you want to use for a more moist surface regarding a wound.
It's really good at pulling out and holding a lot of fluid.
Oh, interesting.
It's kind of like the texture of a kid's play mat that you'd have in a kindergarten or something.
Oh,
Oh, why am I putting that in there? This goes in there. Now with blue guy, what you want to do, and that should be just big enough. So instead of wash, we're going to use saline. These guys break apart, and you can twist off the knob, and it's a fun squirt bottle. You'll take your blue guy, and you're just going to saturate it with all the saline, and you'll find that blue guy gets nice and soft. Then you're going to wring out all that extra saline moisture. Now it's nice, soft, pliable. I'm going to set it to the side just because I didn't quite prep the area and I don't have this one open yet. And I kind of need this to hold that in place.
that's an impressive Band-Aid. I'm telling you, it could serve as a Rorschach test.
What's great about these guys is they work great around a joint. The idea is instead of a heel, the elbow is the heel. This is the flat part of the foot, and this would be the heel. You'll see that there's diagrams here.
Okay.
Again, there's multiple backings. I prefer to start by removing the middle backing. Now Now that I have the middle backing off, I'll take our blue guy. We're gonna just cover the wound base. I didn't put on my skin prep white, but I'm not gonna worry about it because I have yet to see this one come off preemptively. Now that I've got this middle piece on, I want you to straighten your arm a little bit so that the adhesive goes on not when your arm is bent and wrinkled. The rest of the backing, I don't really care the order you do it in. I'm going to do the larger wings and then the smaller wings. It may not look exactly like this depending on the angle that you're working with the arm. My hope is that it just doesn't feel stiff when he's trying to work the arm back and forth. But it is not a perfect science. We want clean, covered, and the foam is good for protection if we bump something.
Well, this is good timing, Dad, because the Mexico-Ecuador match in the World Cup is just about to start. Perfect.
I'm gonna have 30 minutes of leeway between me and that.
I was gonna say the 30 minutes look like.
Bring your arm out just a little so Jeff can see here. I'm just doing the same thing I did on the other side, but on the inside of the arm.
Great.
And how often are we changing the dressings?
You will almost certainly only need to do it once. It is a Monday, Wednesday, Friday change.
Okay.
The only thing is home health is scheduled for the 5th,
Oh.
which I think is Sunday or something. So
Okay.
I've changed it today. You could also count it as tomorrow because it's close enough. So if we say that we did it Tuesday, I would say do it on Thursday or Friday. And
All
that'll
right.
give you time until the home health nurse comes and does it when they come on the 5th.
Roger that. We got you, Pops.
All right, that's all.
Thank you, William.